I'm Leah, and I'm here to share to you what I am doing in my life right now, especially at my work, and also to give inspiration to my co-nurses who haven't gone back yet to the nursing field. I know it's really hard to look for a nursing job nowadays because the population is still big, but what I'm trying to tell here is if you are really willing to do it and set your heart into it, then you could always find the best place for you. Believe me, I did. Alright, before penetrating deeply to our topic, our program, I would like to introduce first the area where I belong. I'm working now at Langsana of the Philippines, one of the specialized hospitals here in our country as a training officer under the program of PMDT, or Programmatic Management of Drug-Resistant Tuberculosis, funded by Global Fund, following the protocol of WHO in cooperation with DOH, BBSP, and of course the implementing arm is Lung Center of the Philippines. Now, as a training officer, one of the biggest tasks and the task that I really enjoy is to conduct training all over the country. So I don't just train inside Metro Manila, but I also travel from Luzon, Visayas to Mindanao. And it's really exciting, right? Because I meet a lot of people, and at the same time I have a great opportunity to share what I know, or what ever knowledge I have learned, to share it to my co-medical professionals. Sadly, I don't have the direct patient care anymore, but I know that, or I believe that God placed me here because I can actually use my skills and my passion in teaching and nursing. Alright, now let's talk about the program, or let's talk about what sort of disease we are treating. Now, we are catering patients who are suffering or infected by Mycobacterium tuberculosis, and that is MDR-TB, not just simple PTB, not just ordinary tuberculosis that we have read or we have studied in college, but this is what we call now MDR-TB. Now, a lot of Filipino people are not really aware what is MDR-TB, or even us, health staff, we're not really aware of what is MDR-TB. Now, in our training, we educate them, we train about the program, and of course, share to them what are the things that they really need to know, and equip them with all the skills that they need in treating patients suffering from MDR-TB. Now, MDR-TB, I'm going to show you a book here. This is actually the hardest and the longest module that we distribute to our participant, because we have a lot of books or modules that we distribute during our training. Now, this is module C, treat MDR-TB patients. MDR-TB, this is a sort of form of tuberculosis that we didn't study in college. What do you mean by MDR-TB? This is actually a form of tuberculosis. It has the same causative agent, the MTB, or Mycobacterium tuberculate, but the bacteria has already evolved, because the bacteria is now resistant from at least two most potent antibiotics, and that is rifampicin and isoniazid. If you can remember the RIPEs, these are the first line drugs that DOTS treatment is using, the DOTS treatments, or the DOTS treatment is using. The RIPEs, remember the HRZES, if you're familiar with the term. We have isoniazid, rifampicin, ethambutol, streptomycin, and pyrazinamide. Now, mostly MDR-TB patients, we don't use the RIPEs medicine anymore. So, on our training, we teach medical staff to design new regimen for MDR-TB patient using another set of, or another line drugs that we introduce on our module C, actually here on our training. Now, I'll be showing to you some modules that we're using and some handbooks that we give to our participants. The first handbook that we're giving is, sorry, I'm back. First handbook that we're giving is, of course, the reference booklet. This is a booklet, or a module, where participants can find all medical terms that they need to know about MDR-TB, and standard forms or template forms for the programs. So this is the reference book. Now, we have module A, but fortunately or unfortunately, I can't find it, so I'm gonna give you now are going to show to you Module B. This is to detect cases of MDR-TB. Detecting cases is very important because TB is not only curable but also preventable. And the first thing that we should study is how to detect early. It's one of the special skills that health staff must learn in treating MDR-TB. Now, another one is we have, of course, I have shown you a while ago that Module C, one of the hardest and longest modules in the training. Now, it's very important because this is the module where participants are learning how to treat MDR-TB patients. By the way, our participants are doctors and nurses, pharmacists, support staff, field coordinator, and all, even social workers and all other health staff that can be of help in implementing the program. Now, why am I conducting training to the physicians? Maybe a lot of you are asking that I'm a nurse and I am conducting training to physicians. They know better. They know this better than I. But since MDR-TB is a case where bacteria has evolved, we didn't study this in college. I bet. Can you remember? Did you have any chance or any memory that you can remember if we studied MDR-TB? No, not right. Actually, when I was in college, I was fortunate enough to have a research about tuberculosis because I had a case study. That was my first case study, and I was the one who did the pathophysiology of tuberculosis. But that was just plain PTB. It's not MDR-TB. We didn't have any idea what is the treatment for MDR-TB. And this is very important because this is happening all over the world, internationally, not only here in the Philippines, but this is a protocol implementing by WHO or World Health Org. Actually, one of the mistakes that or one of the reasons why we are having MDR-TB is because of the wrong treatment that is given by our medical practitioners. They're not following the protocol of WHO, the standard protocol, which is very important. Okay, by the way, here on Module C, hold on.